The Isle of Wight NHS Trust's Community and Mental Health and Learning Disability divisions are making changes to the way we work. The COVID-19 pandemic has put a lot of pressure on health and care services. Our staff have risen to the challenges we've faced over the past 2 years, and we are really proud of how they've adapted so well. We know people need the right working environment at the right time to feel valued and be the most effective they can be. This is why we are adopting a new approach to Agile working. Agile working is the term used to describe when people work in different locations at different times, usually on mobile devices like a laptop or a tablet. This could be in a trust building, out in the community, on partner sites, or at home. Agile working environments might include touchdown spaces, bookable desks, and group spaces. There are many reasons we need to change the way we work. Our estates are under significant pressure because of rising demand as a result of the COVID pandemic, an ageing population, as well as new treatments becoming available. The move to remote working during the pandemic period had to be done quickly. We know there are things that could be better for staff and want to make those improvements. The NHS long-term plan and people promise requires us to integrate health and care services across the trust and its partners closer to where people live and find new ways of working and delivering care. Patient care is changing, for example, the use of remote consultation. Finally, we must reduce the environmental impact of the NHS and improve our carbon footprint. We can only do this if we make the most of our clinical spaces and offices. Last year, we asked staff for their views on Agile working. The feedback we received helped us to understand some of the concerns that people have. The term Agile can cause confusion for some people, resulting in frustration and worry. Connectedness is essential. Staff were concerned about the risk of losing a sense of belonging to a team and being able to work effectively together. Staff felt they did not have the required space and equipment to work at home or out in community settings. People were concerned that managers weren't equipped to support and supervise staff who work remotely and felt teams needed training in Agile working. IT issues such as connection problems, IT updates and software or roaming profile issues can make Agile working difficult. And concerns that the current estate doesn't provide the different spaces we need, like clinical space to see patients and office space for teams to work and meet. We have listened to these concerns. Our new Agile working approach will ensure that staff have office space that is accessible fairly across the clusters. This includes spaces for staff who need reasonable adjustments. Allocated space for clusters to enable teams to work together, stay connected and maintain a sense of belonging. Space for breaks and refreshments in every location. Adequate storage space such as lockers for personal and work items. A booking system for desks, clinical space and meeting rooms that is hassle-free. Touchdown space available to simply turn up, sign in and work efficiently and comfortably. The right technology to do the job with excellent connectivity and IT issues being dealt with quickly and efficiently. Compatible devices such as printers and scanners available in all locations. Managers who know how to lead Agile teams and support them to maintain social connections and effective team working. And suitable space for team meetings and supervision that's safe and confidential. This will take time to get right. During the transition, there will be times when some people may feel uneasy or frustrated. We will ensure staff are supported during this journey and that we listen to feedback. Every cluster will have an Agile champion to deal with any issues and gather ideas and concerns. We will communicate regularly across both divisions to make sure that everyone has the information they need, staff feel listened to, and any issues are resolved as soon as possible. We will work together with staff to develop a roadmap of the journey we will take as we implement this new approach over the next 2 years, addressing training and development. We'll ensure training and support is readily available. Policies and procedures. We'll ensure that we put the right policies and procedures in place to protect staff wellbeing and team relationships. IT challenges. We will work closely with ICT to make sure staff have the right kit and access to the systems, and that support is available when and where it's needed. Improving estates. We will ensure all of our locations can be utilised effectively. Some of the benefits we expect to see include teams coming together and feeling valued with a sense of belonging, improved staff satisfaction through having access to the right tools and resources, greater flexibility and autonomy for staff to work in a way that suits them, improved work-life balance, a reduced carbon footprint on our way to net zero, and saved staff time, reducing the pressure on teams and improving how we use our resources. Moving to Agile working will allow community and mental health and learning disability staff to access the right space at the right time in the right place. This will improve staff wellbeing and work satisfaction and lead to better outcomes for the people we serve, including Mary from Shanklin. Thank you for your time, and if you're interested in helping us shape the future of Agile working, please contact us on the email addresses shown to find out how to get involved.